Hi, and thank you so much for stopping by the HCMA's virtual booth. I'm Lisa Salberg. I'm the founder and CEO of the HCMA. While you're stopping by the booth, we thought we would take our time to tell you a little bit about some of the services of the HCMA if you happen to not quite catch our event on Saturday evening here at the summit. So I'm going to walk you through some slides and tell you a little bit about the HCMA. So first of all, we were founded in 1996. We're a 501c3 nonprofit organization with our offices based in New Jersey, United States. We were founded out of a tragedy that has evolved into a beacon of hope for patients and families worldwide. We provide support, education, and advocacy for patients, their families, as well as the medical community and lay public about HCM while supporting research and fostering developments of treatment. We have many objectives. They include educating people about the symptoms and treatment options for patients and their families, as well as medical providers. We provide advocacy for public policy legislation that improves disease detection, healthcare access, and matters of importance to the HCM community. We develop and maintain a network of support for individuals with those with HCM. We increase accessibility to specialized treatment with professional programming called our HCMA Recognized Center of Excellence program. You'll hear more about later. We promote and publish research. We promote and publish research on HCM and broaden access to the results with the ultimate goal of eradicating HCM altogether. We partner with complementary organizations that will help us fulfill our mission. And of course, we must generate funding to make sure that what we are doing is sustainable. These are members of our board of directors. I would just like to take a moment to thank them all for their service to the organization. They continue to help us grow and evolve into an organization that truly meets the needs of the patients as well as the medical community. We also have some amazing staff members here at the HCMA who keep everything running. Without them, I would not be able to do the work that I do every day as the CEO. And I just noticed that I left my own name off of this, so that's kind of funny. My team is fantastic, and I thank them each for their contributions. And we have an announcement of a new team member who will be joining us on November 1st. Stacy Titus will take the position of Center of Excellence Coordinator. That name may sound familiar to some of you. Stacy's actually my niece and the daughter of Lori, who the organization was founded in memory of. And she has a lifetime of experience working in the HCM community. And she will be bringing her excellent administrative skills to the HCMA to help us build out our Center of Excellence programming even further. I'd like to say that when possible, the HCMA does hire from within the community. So many of our staff members either are HCM patients themselves or have family members who are HCM patients or are just about close enough to be family to some people who might have HCM. So they have excellent skills as well as a passion for the cause. I wanted to talk to you about something really exciting that's going to be starting very soon. It's called HCM Academy, and the HCMA is a partner in this process. What is it? It's getting involved with interactive digital workshops that we are building out a network of individuals who can help provide one-on-one training, not one-on-one, but group training to healthcare professionals about HCM. And it is a CME online course, and there are a lot of different activities that are going to be available through HCM Academy. The faculty is myself, Marty Marin, Anjali Owens, and John Lynn Jeffries. We created the infrastructure with a company called PCM Scientific out of the UK. And this is a CME accredited program, and the HCMA will be providing logistical support of this program. And Amy Mann, our meeting coordinator, will now be taking on the additional role of HCM Academy coordinator. So we're happy to have her in that role. So what does this consist of? Sorry, I've been doing a lot of these podcasts lately, or these recordings lately. It's digital content. There'll be 6 online CME educational modules, 5 online case studies, and 5 online non-CME patient perspective videos provided by wonderful volunteers for the HCMA. There'll be a workshop module as well, and you will be able to attend workshops and encourage others to also participate in the workshops. And online learners will be invited to take deeper learning opportunities as well. It is not quite open for registering yet, but we are collecting those who are interested through the HCMA site. And I'm going to walk you through that in just a moment. I do want to acknowledge that HCM Academy is provided with support from a number of different organizations, including Bristol Myers Squibb, Sanofi, and Cytokinetics. They have no running, they don't run the curriculum, they just provided financial support, and all activities are run at an arm's length from the financial supporters, and they have had no input on the content. I assure you that content is amazing, and it is intended for cardiologists who do not specialize in HCM, general practitioners, and other healthcare providers, and pretty much anybody we can get to learn about HCM. We want emergency room physicians, we want OBs, we want orthopedics, we want family practice, we want pediatrics. So anybody you know who might benefit from learning a bit more about HCM, you can encourage them to join, and we're going to give you a platform to help us engage with them as well. So we'll be talking a lot more about that over the next year. Okay, so next we want to talk about our new committees that we're forming at the HCMA. We have two new committees that we're going to be seating and for the first time in the first quarter of 2022, including our Health Equity Committee and our Medical Affairs Committee. There are two other committees that we are going to be recruiting for additional members of, and that is the Legislative Committee and the Patient Education Committee. So you will have an opportunity, and I will walk you through how you can sign up to become a volunteer on one of our committees. We are looking for members of industry. We're looking for members of HCM Centers of Excellence. We're looking for lay cardiologists. We're looking for patients to participate in these committees to help us build the strongest organization and body of services possible. So it doesn't happen in a silo, people. We need everybody to help us in these initiatives. So if you have been listening to any of this content at the summit, or if you've read the recent guidelines, we know that high volume HCM care matters. And I'm happy to say that the HCMA was on the forefront of the development of this programmatic model back around about 2020 or about 2008 or so. We really started pushing these out as a system. And over that time, there were about 5 or 6 programs that were already existing when HCMA came on the scene in 1996. And we have developed now 43 programs with 16 in the pipeline, hopefully in the next 24 months that we will come to some conclusions on. If you would like to join the HCMA network of providers in our Center of Excellence programming, I'm going to walk you through the website in just a few minutes and show you where you can get more information and where you'll be able to email us from if you want to inquire on how to become a center. The centers do not have to just stay on that map that I just showed you. So the world has HCM, so we're working to create more connections. We're working on developing international patient advocacy, and I'm happy to say I'm working with Sweden, the Netherlands, Italy, Australia, and other nations to find patient advocates that we can help train that can help guide patients from the community to the proper levels of care. We are also working on, and hopefully will be available first quarter of 2022, new international HCMA designation for Center of Excellence partners. We know that every country has a different healthcare system and that the access is going to vary based on the country, the healthcare system, payer systems, et cetera. So we are working to very carefully evaluate how we can engage all of you so that there will be one-stop shopping for HCM care right on the HCMA website, where patients from around the world can find reliable information on where there are healthcare providers that have experience in HCM. You can email our COE coordinator at coecoordinator@4hcm.org. She's onboarding starting November 1st, so it may be a few weeks before you hear back from anybody. So be patient, we will get back to you. We want to work with you as much as you want to work with us. We encourage you all to join our LinkedIn community of medical professionals. We have over 2,200 members from over 80 countries as part of that group, and we're going to be doing a lot more work with that group in the coming year. For your patients and for those wanting to know the activities of the HCMA, including fundraisers and other activities, I encourage you to follow us on Facebook. And the page is here. So we have pages and groups. Let's talk Facebook language for a moment. So this would be the official page of the HCMA, which is for HCM. So on Facebook, just search for the number 4 HCM and you will find that page. Attached to that page are groups. Groups are discussion groups meant for patients. I know some of the physician community wants to join the groups just to kind of be a voyeur. Sorry, we like patients to have an opportunity to talk amongst themselves. So these are patient groups only, and there's the HCM Parents Communication Network as well as the HCM discussion group. There are currently just shy of 8,000 people in this discussion group, and we have begun HCMAI programming, which is down here where we have a Facebook group that is Swedish language, and we have one that is Dutch for the Netherlands. This is a mock-up of the header page. I don't know if it's been approved yet or not, so it might look a little bit different than that when you finally see it attached to our page. I encourage you all to participate in discussion groups. If you are a healthcare provider who would like to provide insight into a discussion group and participate with a small group of individuals on a particular topic, you're going to be getting a questionnaire soon. And that questionnaire will be, what discussion groups might you be interested in? We're looking for physicians, nurses, genetic counselors who are willing to spend an evening once a month or once every couple of months working with discussion group leaders to help educate patients and help them understand HCM at a deeper level. We've been running these groups for just shy of a year now, and they're really starting to take off, and they are a wonderful way for patients to support each other. We've had deep discussions from the transplant pathway group on how to prepare emotionally and physically for transplant. We've talked about ICDs. We have a lot of discussions on myectomies and septal reduction therapies, and it is a wonderful place for patients to meet together. We've trained about 17 moderators to date, and they team up in these meetings so that they're there to help facilitate discussion. They have been really fantastic opportunities, especially through COVID, for people to feel connected. And face it, support groups are a little hard to run in person for those with HCM after a busy work day. They don't typically have the energy to get up and go out to a meeting. So popping up the Zoom camera and showing up with a dozen of your friends who are going through similar experiences has become incredibly important. And we encourage you to let your patients know about it. They are safe places. We have very strict rules on rules of engagement and scientific data, et cetera. So they are well monitored, well attended, and you can feel very confident that your patients will have a positive experience in these groups. If you haven't heard yet, we have a podcast. It's called Tales from the Heart. I am the host, and once a month I'm joined by Dr. Marty Marin, who you've probably heard about, and Dr. Harry Lever from the Cleveland Clinic. So I meet with them once a month, and we pick a topic of the month, and we kind of stick with a theme. It is emotional wellness is the theme for October. So we're talking about the implementation of mental health services into HCM care this month, for example. Other months, we may talk about family screenings or arrhythmia risks, et cetera. So we try to pick a topic and stick with it. However, we have 2 other Fridays every month that are open. And in 2022, I'm looking to bring in a lot more diverse voices to have conversations on podcast. We've brought in members of industry to discuss clinical trial results or upcoming clinical trial recruitment. We've used it for a lot of different purposes. We've got almost 40 episodes recorded so far. If you haven't seen it yet, please, wherever you get your podcasts, search us, we're right there. So if you want to join us for a segment, all you need to do is send an email saying, I'm interested in podcasting with Lisa, and tell me what topic you want to talk about. And we'll look at the calendar and figure out when we can schedule that in. We look forward to sharing a lot more perspectives on HCM. If you're a nurse and you want to talk, if you're a genetic counselor, if you're a physician, if you're a researcher, if you're industry, send us ideas and emails. Sometimes we bring in patients to join us on these conversations. I've also done podcasting with authors on different books as they relate to healthcare or wellness or cardiology in general. So please send us your ideas, and we're happy to have you join us. I want to thank you for watching this segment, and I am actually going to pull up the HCMA website on another piece here, and I'm going to do another screen share, and then we will walk you through how to best navigate the HCMA website, where you can find some of the features that I just explained to you. So let me just pop this over here. And there we go. So we relaunched our website in June of this year, actually on June 25th. Why do I know that day? Because it's the same day I became a great aunt to a little bundle of joy named Xander. So we kind of gave birth twice that day, a new website and a new family member. So this is the new page. It's much easier to navigate than the old one. Getting started for patients is handled up here. The diagnostic journey, the symptom journey, medication journey, et cetera, are all right here. Programs. So today I'm going to talk to you about the HCM Academy and how you can get information on that. So it's under programs, and you'll come right here, and it'll tell you a little bit about HCM Academy, what it is, the faculty, who the sponsors are, and our partners. Pretty nice partners. We're partnering with American College of Cardiology, American Heart Association, and HSFA. So that's nice. If you are a patient, you can refer your provider. So if you want your local doctor to know about HCM Academy, you can click that button and refer your own physician. If you're a provider, you can click this button and refer yourself, and we'll send you additional information later. So let's just take a walk through what that looks like. So you'll come to this page where there's not only HCM Academy, but some of our partner organizations have great education on HCM too. ACC has Route HCM, and then we have the American Heart Association with their professional curriculum. They're doing some educational programming, webinars, podcasts on HCM, and they're all located right here. But if you want to register for HCM Academy, you'll just click here. It'll bring you to a registration document. This is probably going to get updated in a couple of weeks. So when you come in, it might look a little bit different. We want to just have a little bit more granular information there. Once we collect your information, we'll be sharing it with our partners at HCM Academy, and you can see it there. Now, let's say you're a patient and you want to refer your provider. You'll come into this form, and we're going to ask you right up front, can we use your name when inviting your doctor to participate in HCM Academy? I think it's really important that the physician knows which patients are engaging with them to learn more. So if you're comfortable with sharing your name, the letter will be simply, Dear Dr. Smith, patient Susie has referred you into our HCM Academy program, which is a free CME course to help you learn more about hypertrophic cardiomyopathy. That will be basically how it's handled. So if you can get us the name of the physician, the address, if you can get us an email address, that's best. And if you can let us know what kind of provider they are, that would be really, really helpful. So I want to go back to the front page of the website, and I want to talk to you about the Finding Care. This is where our HCM Center of Excellence information is maintained. And you can find out what it takes to become a center, why should patients go to centers, and how do they make an appointment with a center. There will be a button on this added shortly that says contact us for more information on becoming a center of excellence. And I'm going to guess it's going to be right about here on the form. I thought it was already up, but it'll be right there. If you want to see the full directory, you can click on here, and it takes you to the full directory of programs. And we are proud of every single one of them. Okay. So that is what I'm going to take you through today. You're going to start seeing some more activity in the advocacy area. And from here, you're going to start to see our legislative advocacy efforts really kick up. And there will be more information here on how to participate with a software package called UJoin. We are moving forward with legislative initiatives to improve the well child examination process to include cardiac features, much like the PPE. All of this information will be available online shortly. The program is just launching right now. We've done some beta tests with training, and we're just finessing that program ever so slightly. So that is, that's the new website. And these are some of our new programs, and this is how to access it. So if you want to find our podcast, if you want to find any other information, you can see our international partnerships here. And this talks about HCMAI. We have a brand new big-hearted blog with news alerts and other blog posts. We have a memorial page that is being built out as well. So I encourage you all to stop by and take a look and meet some amazing people. You will see the voice of the patient videos here directly from patients about their experiences with HCM. So we encourage you to stop by, listen and learn, and become a more active part of our community. We appreciate you being here today. So without any further ado, I'm going to let you get back to some other trade show booths here at the virtual exhibit floor for the seventh International Summit. Congratulations to Barry Marin and Marty Marin for putting on an absolutely wonderful event. And we are a real proud partner in this endeavor. Thank you so much for your time and attention today.